Muscles of auricle. There are three extrinsic auricular muscles such as posterior auricular muscle, PAM, superior auricular muscle, SAM, and anterior auricular muscle, AAM. There are 6 intrinsic muscles such as helicis major, HMJM, and minor, HMNM, trachecus, TR, antitrachecus, ATR, transverse auricular muscle, TAM, and oblique, OAM, muscles. Anatomy of the human ear. The incus or anvil is a bone in the middle ear. Stapes is a small stirrup-shaped bone in the middle ear. Decompression facial nerve, INTRA temporal, lateral to geniculate ganglion. Through a postauricular incision, the physician drills out the mastoid cavity. The sigmoid sinus is exposed posteriorly. The posterior ear canal wall remains intact. The horizontal semicircular canal and part of the incus are visualized. The vertical portion of the facial nerve is exposed. The facial recess is opened and the bone over the horizontal portion, middle ear, of the facial nerve is removed. The incus may be separated from the stapes. The incus and part of the malleus may be removed. The facial nerve sheath is incised from the stylomastoid foramen to the geniculate ganglion. The postauricular wound is sutured and a dressing is applied.
Decompression facial nerve, intratemporal, including medial to geniculate ganglion. Decompression continues medial to the geniculate ganglion. The incus and part of the malleus are usually removed.
Total facial nerve decompression and/or repair may include graft. A vertical incision is made just anterior to the auricle and is extended superiorly to expose the temporalis muscle. The muscle is divided. A section of the skull, craniotomy, is removed to expose the dura over the temporal lobe of the brain. The dura is elevated off the floor of the middle fossa. The bone over the facial nerve is removed with the drill. If there is a tumor of the facial nerve, it is resected. If the nerve has been transected because of trauma, it is repaired with sutures. A nerve graft may be needed. A transmastoid approach may also be needed if extensive decompression is required. A muscle graft is placed over the floor of the middle cranial fossa. The bone plug is replaced in the skull defect. The incision is sutured and a dressing is applied.